So Voices from Oxford today is talking about a very interesting use of a piece of technology by somebody working in the Churchill Hospital here in Oxford, and his name is David Cranston. Now, David, you work with ultrasound, and I think most of the viewers of Voices from Oxford will recognise ultrasound as one of these pieces of technology one uses to image stuff in the body and so on. But you're doing something rather different, aren't you?
Yes, I think that's right. I think everybody realises, knows what ultrasound's about, and obviously, you know, women who are pregnant have ultrasounds to look at the babies. And what you're interested in normally is what's reflected, the beam that's reflected back, because the ultrasound beam bounces down and then is reflected back by the tissue.
Because the tissue's got different, as it were, structure, yes, and therefore can reflect at different degrees, yes.
And so therefore what you're looking at is an image of what's down there. But interestingly enough, at the focal point where the ultrasound hits the different layers and comes back, even with ordinary ultrasound, there's a very small rise in temperature, probably about a fraction of a degree centigrade. And what we've been looking at is high intensity focused ultrasound. So if you put the power of ultrasound up about 10,000 times, huge amount, you can actually cause damage at the focal point, and you can cause a lesion at the focal point.
Now, when you talk about a focal point, this means you've got the beams. There's more than one beam?
Well, the ones that we use at the moment is a beam coming from what's called the transducer. Yes. And the best way to think about it is that we all know as children we had the magnifying glass, and if you focus the sun's rays onto the back of your hand, if you got it at a sharp focus, you could cause a burn. Yes, indeed. Well, you can do the same with ultrasound, although ultrasound doesn't travel very well through air, but if it travels through liquid and fluid and the body, you can do exactly the same. So you can cause a burn at the focal point if you put the intensity up, and as I say, about 10,000 times the power of normal ultrasound.
Now, why should anybody want to do that?
Well, the interesting thing about that is that what you can then do is you can start treating things at the focal point. So what you can do is, if you've got tumours, if you've got cancers, and indeed benign conditions as well, like uterine fibroids in ladies, what you can do is every time you fire it, you get a lesion the size of a grain of rice at about 80 degrees centigrade, so you get instantaneous cell death. Yes. And with the use of computers, you can just fire it and then move it a fraction, fire it and move it a fraction. So essentially you can start painting out a tumour or a fibroid and actually destroy tissue without making any holes in the body.
So this is like surgery done with a kind of invisible knife. Yes. And when you say you can trace out, presumably therefore you get an image first.
So there are two ways of getting an image. The machine that we work with, which is a machine developed in China, we have close links with a group in China, we have done for about 12 years. And that's, you have an image with a diagnostic ultrasound, which is in the same sort of area. There are other machines around which are linked to MRIs. That's not quite as instantaneous, because what you have to do is put the person into the MRI machine, get the coordinates, bring them out, and then treat them.
MRI is magnetic resonance imaging, which is a different way of imaging. But either way, you're getting a clear picture, or hopefully clear picture, of what is there, where the possible cancer or other structure is, and then you can literally go around it, as it were.
So what you do is you start at the back and you come forward. And it's still relatively early days yet. The technology will get better. We had the first Chinese machine in the Western Hemisphere back in about 2002, and we got it CE marks, the European certification, so that it could be used in the West, and we were looking at it for liver cancers and for kidneys. It works, not every tumour is suitable for this. They have to be in the right position. Sometimes ribs get in the way, and indeed with kidney, sometimes the fat around the kidney absorbs it as well.
Right. So you've got to, if possible, have a region of the body where there's a good clear view for the ultrasound to go through.
A window in, which is why actually uterine fibroids is a very good thing to treat, because they are easy to treat. The other thing about the cancers, of course, is that one's keen to treat the whole thing. With the uterine fibroids, actually, if you don't quite get the whole thing, they still often get a good response. And because it's not a cancer, it doesn't matter.
It doesn't matter if it... No, exactly, yes. So you're not sort of in fear of it suddenly exploding again.
Indeed,
no,
indeed.
That's right. Going back to what you were saying earlier on, this is, you said an increase in intensity of 10,000 times, and you take that local bit of tissue up to roughly 80 degrees, which is getting close to boiling, isn't it?
Yes.
So this really is invasive in the sense that you want, isn't it?
Yes. And there are very few side effects. I mean, you have to go through fluid or body tissues. You mustn't, the bowel mustn't be in the way because of the gas in the bowel, and if bowel's in the way, you don't treat, because you could make a hole in the bowel. We don't go very close to the big blood vessels, although theoretically, because of the flow of blood through them, that would take the heat away, and it may be okay, but we at the moment avoid that.
Naturally be careful. Yes.
The other very interesting thing which is being developed in some parts of the world, linked to the MRI, magnetic resonance imaging scanners, is that nowadays you can actually start to treat with ultrasound through the brain. Now, the problem with obviously the brain is that it's enclosed in the skull, and when you put an ultrasound beam in the skull, it alters. But what the clever physicists can do, of course, is measure the distortion of the ultrasound as it goes in, and then put a distorted wave in, so that once it's in the brain, it can be used. And they're just starting now in, I think, Toronto and Zurich and one or two other places, to have what's called phased array transducers. So you have lots of different transducers around the brain, and they are starting to be able to get very discrete lesions within the brain through the intact skull.
So again, treating a growth in the brain.
Yeah, so they're just starting to think about treating brain tumours with that. And I think the thing about all this technology is that we know that technology improves. So I think in the future we'll see a lot more of that come.
Two final questions for you, David. First is, presumably, so far as the treatment, a successful treatment of cancers is concerned, it's been through clinical trials.
Yes, well, we've put it through clinical trials. As far as kidneys go, we're still a long way off being able to get 100% treatment. The clinical trials on kidneys, because of the issues that I've spoken about, sometimes you're not sure if you've done it. The ribs and the fat get in the way. The clinical trial that we did with kidneys is that we treated and then we took the kidney out and looked at it. Some of them, the cancers were completely destroyed, others were only partially destroyed, a few weren't at all. So the technology needs to improve. We have got ideas of improving that. With the livers, again, it's good. The other problem with it, which again is being addressed, is that it does take quite a long time. It takes about 2 hours to treat a lesion of about 4 centimetres, but there are moves afoot to increase the time of that. So I think over the next few years things will improve.
See further improvements as the technology advances. So my final question, David, is some of the technology comes from China, which is interesting.
Well, it's very interesting. We've been working with a group in China, and in fact I took a colleague, Professor Hamdi, over there in October, thinking that Oxford would have a lot to offer in terms of development. In fact, the place that we are working with in China is now recognised as the national ultrasound research establishment in China, and in fact I don't think there's much in terms of technical expertise we've got, but what we have got that we can offer them that they're not doing particularly well is the clinical trials. I think their technology is brilliant, but they're grateful to us for helping with the clinical trials.
Well, thank you very much, Dave, for telling us about a fascinating new use of a piece of technology and giving hope to a lot of people who might suffer from cancer. So thank you very much for talking to Voices from Oxford.
Pleasure.